All right, everybody, welcome back for another deep dive with me. Today, we're tackling something that I know can be kind of a pain point
Hmm.
for a lot of people looking for jobs.
Oh, yeah.
Resumes.
Yeah.
Specifically, resumes for folks in healthcare, whether you're a doctor, a nurse, a technician, or really any role in the healthcare field.
Right.
We've got you covered
Yeah.
because crafting a resume that stands out from the pile,
Yeah.
that's a skill in and of itself.
Absolutely.
So luckily, I have an expert here with me today who can give us some incredible insights on just how to make your resume shine and actually land you that interview for that dream healthcare job.
I'm happy to be here.
Perfect. So we're taking all our tips from this really great in-depth guide that we found, and I think listeners are really going to get a lot from this.
I hope so. There's some great stuff in there.
Yeah. So to kick things off, like when we think about healthcare resumes, what makes them so different from resumes in other fields?
Well, a lot of people think a resume is just a list of, where you've worked and what you did. But in healthcare, it's got to be way more than that.
Yeah, because it's such a specific field.
It is. Because at the end of the day, healthcare is about taking care of patients
Right.
and keeping them safe. And to do that, you need some very specific skills and knowledge. So your resume has to reflect that.
Okay, so it's not enough to just list like, oh, I worked in this hospital from this date to this date. Like, what's the first thing that someone should really do when they're even thinking about starting to write or update their healthcare resume?
The first thing you have to do is get into the mindset of a detective.
Ooh, I like that.
Right.
Put on your detective hat.
Put on your Sherlock Holmes hat and
Yeah.
really, really dissect that job description. Don't just skim it over. You want to print it out if you have to, highlight it, underline it,
Yeah.
take notes, really understand what they're looking for in this specific role.
Okay, so for example, like what kind of things should we be looking for specifically?
So, look for those key medical terms. Are they mentioning specific conditions, procedures? Are they mentioning like RN or MD? So you know exactly what kind of credentials they're looking for.
Okay.
Also pay close attention to the way they describe the ideal candidate.
Oh, okay.
Like, are they looking for someone who's passionate about patient outcomes or someone with experience with electronic health records? Those are like your little clues.
Yeah, so it's a reading between the lines, not just taking it at face value.
Exactly, exactly. And something that a lot of people miss is this idea of core competencies.
Okay, I've heard that term before, but I'm not really sure what it means in this context.
So core competencies are the skills and traits that are absolutely essential for the job,
Okay.
right? So let's say you're applying for, I don't know, a leadership role in like a cardiology department,
Yeah.
right? The job description might say something about like strategic planning or team leadership or even experience with quality improvement initiatives.
Okay.
Those are your core competencies for that specific role.
Okay, so we gotta like figure out what those are and then make sure our resume is like screaming those competencies out loud.
Yeah, like, put a big spotlight on them.
Yeah.
Because that's what's going to grab their attention.
Okay, great. So we've dissected the job description. We understand the core competencies that they're looking for. What's next?
Next comes the part that a lot of people find really challenging, and that's matching your own skills and experiences with what the job description is asking for.
Oh, yeah. This is where I think a lot of people get stuck.
Right. And I see this all the time where someone might say, well, I've been a nurse for 5 years, but I've never actually been a manager, so I can't apply for that leadership role.
Right. Mhm. Yeah, I've totally been there.
But here's the thing, right? So much of what you do in healthcare, regardless of your specific role,
Yeah.
involves transferable skills.
Mm.
Things like teamwork, problem solving, thinking on your feet, making critical decisions.
Right.
These are all valuable in any healthcare role, whether you're at the bedside or you're leading an entire department.
Okay, this is blowing my mind a little bit. So how do we actually showcase those transferable skills effectively on our resumes so that the person reading it is like, oh, I see it. I see what you're saying.
So it all comes down to framing.
Okay.
You want to take those experiences that you've had and present them in a way that really highlights those core competencies that we were talking about earlier.
Oh, okay.
Right. So for example, let's say you are that nurse who's been working for 5 years and you want to move into a management position.
Mm-hmm.
Maybe you've taken initiative to mentor other nurses on your unit.
Yeah.
Or maybe you've helped streamline a process to make things run more efficiently.
Right.
Those are all examples of leadership skills, even if you haven't had an official leadership title.
Okay.
Right. So you want to really dig deep and think about those experiences and how they demonstrate those competencies.
Wow. Okay. I am definitely going to be rethinking my entire resume after this.
Good. That's what we want.
So we've identified our transferable skills. We're ready to kind of like revamp our resume.
Yeah.
Now let's get into the actual nitty-gritty of like what this thing should look like.
Okay, so now comes the part where you really take your resume from good to great.
Ooh.
And that's all about customization.
Okay, so it's more than just listing our skills. We got to tailor it.
You have to tailor it, yeah. So this is where you really think about the specific job that you're applying for and make your resume speak directly to that.
All right, so where do we even begin?
Well, first of all, that little summary at the top of your resume, that's prime real estate.
Okay.
Instead of just a generic overview, this is where you really showcase your expertise in healthcare.
Got it.
So let's say you're that experienced nurse who's applying for a leadership position, right? Instead of just saying experienced registered nurse, you could say something like registered nurse with 10 plus years of experience in acute care settings, specializing in, let's say, cardiac patient care and leading multidisciplinary teams to improve patient outcomes. You see how that's so much more powerful?
Yeah, it is.
And it speaks directly to both the specific area of healthcare that you're interested in, as well as that leadership aspect.
Okay, that is way better than just saying like experienced nurse like we see on so many resumes.
Exactly.
Okay, so we got our summary down. What's next?
Next up is your skills section. And you really don't want to underestimate the power of this.
Okay.
This is where you highlight those certifications and specialized skills that are like gold in the healthcare world.
Oh, yeah. Like what?
Things like, you know, if you're ACLS certified or you're proficient in a specific electronic health record system like Epic,
Okay.
or if you have experience with quality improvement methodologies, these are all things that are going to make a healthcare recruiter sit up and take notice.
It's like we're building a toolkit, like a superpower toolkit for this resume.
Exactly.
Exactly.
Okay, so what about the work experience section, which honestly for me has always been the bulk of my resume? So this is where you want to be really strategic and prioritize the roles that are most relevant to the job that you're applying for.
Okay.
Right. Let's say, for example, you're applying for that nurse manager position, and you've had experience as a charge nurse, a preceptor, and a member of a quality improvement committee. You really want to highlight those roles prominently because they directly relate to that manager position.
Okay.
You might even de-emphasize some of your earlier roles that might not be as relevant.
Oh.
You know, maybe you were a barista for a while when you were in college. That doesn't really need to be front and center.
It's like a puzzle. We're trying to make all the pieces fit together. So let's talk about bullet points. Because honestly, I feel like that's where I struggle the most. Like, how do we make those really pack a punch and stand out?
Yes. Bullet points, they can be tricky, but they're also your chance to really showcase what you've accomplished.
Yeah.
And connect it back to that job description. So instead of just saying, you know, provided patient care, which is very generic, you want to use specific action-oriented language.
Okay, give me an example.
So for example, you could say something like, implemented evidence-based protocols to reduce patient falls. Or you could say, collaborated with an interdisciplinary team to streamline the discharge planning process. You see how much stronger and more specific that is.
Yeah, it like brings it to life.
Exactly. You're showing them what you did, not just telling them.
Okay. Show, don't tell.
Show, don't tell.
Got it.
And when you're writing those bullet points, really think about those keywords that we talked about earlier from the job description. Weave those in, because that's going to help your resume get past those applicant tracking systems and actually land in front of a human being.
Okay, so we got to be strategic with those keywords.
Absolutely.
So we talked about the summary, the skills section, the work experience, the bullet points. We're almost done. Is there anything else that we need to know?
Oh, there is one more thing, and it's something that people often overlook, but it's super important, and that's formatting.
Oh, okay, yeah. I think a lot of people think that the content is the only thing that matters. But how it looks matters too.
It does, especially in healthcare, where attention to detail is so crucial.
Right.
So make sure you have a clean professional format. You want those medical credentials, like your RN or your MD, to be clearly visible at the top.
Okay.
And for goodness sake, please proofread.
Yes.
Triple
Like,
check everything. I can't tell you how many resumes I've seen with typos or even errors in medical
oh
terminology.
gosh, that's so embarrassing.
It is
Yeah.
embarrassing, and it makes it look like you don't care. So take that extra time to proofread, make sure all your dates are correct, all the names of your references are spelled correctly, everything is
I
perfect.
have a really embarrassing story about this. One time I sent a resume and I had like a typo in the name of the hospital I was applying to.
Oh.
I didn't even get a call back.
I can only imagine why.
Yeah. So proofreading is so important.
It's essential.
Well, it sounds like we've covered a ton today. We've talked about how to channel our inner detective to really understand the job description,
Uh-huh.
how to match our skills strategically, how to customize our resume to make it shine, and of course, the importance of proofreading.
Absolutely.
Any final words of wisdom for our listeners who are about to embark on this resume writing journey?
At the end of the day, your resume is more than just a piece of paper. It's your story.
Mm-hmm.
It's your chance to showcase your passion for healthcare, your skills, your experience, and your dedication to providing excellent patient care. So make sure it reflects who you are and what you have to offer.
So well said. Thank you so much for joining me on this deep dive today. I hope everyone listening feels really empowered to go out there and create a resume that really helps them land that dream healthcare job.
My pleasure. Good luck, everyone.